We're good. Hello, Tanche Tawau Tout Le Monde. Hello and welcome everyone to the Indigenous Women's Health Talk today, honoring our bodies, where we're going to be discussing breast cancer awareness and the strength in early cancer screening. I have with me today Samara Anderson, who is the Indigenous Diabetes Awareness Program Coordinator. Sorry, Samara.
That's okay. Thank you. Thanks for having me.
And we are just going to jump right into our program very shortly. Before we begin, I just wanted to let everybody know that before this event, both Samara and I put down tobacco so that we could start this day and this gathering in a good way. So for those of you who are joining in virtually at this time or maybe viewing this event later, we wanted to just say thank you for joining us. Marcy, Miigwech, and Niawe to all of you. So we have one housekeeping item to just cover, and for those of you who are new to the Indigenous Women's Health Talk format, we really like to invite everyone to share their voices with us through a survey that we will be posting shortly in the next few minutes. And I wanted to just let everybody know that we really do review all the surveys that we get. We go through all this information and we use it to create and schedule all the future Indigenous Women's Health Talks. And so as a thank you to everybody who submits a survey and who is comfortable providing us with their contact information, we will be submitting your name into a draw for a gift, and we'll be mailing it out to you. For those of you who might be joining in outside of Ontario, at this time, I just want to apologize. Unfortunately, we won't be able to ship out any gifts to anyone outside of Ontario. But otherwise, these surveys are completely anonymous unless you choose to put your name down on there. Okay. Also with us today is Chelsey Enders, and she's a medical radiation technologist who specializes in breast imaging. And very shortly, she's going to be sharing, here's Chelsey. She will be sharing her knowledge and her wisdom. And so my last little call out to everybody is just to invite everyone in this moment before we dive into this information to think of any questions, anything that you're curious about. Maybe it's about breast screening, maybe it's about the mobile Ontario cancer screening bus, anything at all. Please, around cancer and screening, start typing them into the chat box for us now, and we will gather them up and make sure that we can read them all to Chelsey before the end of the day. So one more thing I also just want to say is that ahead of in November in Thunder Bay, which is where we all are today coming from, we have the mobile screening bus. Come on in, Samara. The mobile screening bus will be here just over by the Ray office at the Canada Games complex on November the 10th. And Samara and I will be there in the parking lot just to say hi to everybody that's joining us there. If you are in Thunder Bay or in the area and would like to sign up for screening on that day so that you can see Samara and I, please, we will post oh wait, do we have a post route?
We don't have a poster.
Oh, I'm so sorry.
That's okay.
I forgot that we were going to post a number just to call and schedule. But we can also post Samara and my email, and we can make sure that you're on the schedule that day if there's any spots left. Mm-hmm. Okay, so at this moment, I'm gonna we'll just move into our really short presentation before I pass the microphone over to Chelsey. If we can post a survey in a couple minutes, that would be great. Okay, so I just want to be, as we start here, I just wanted to share with everyone just some goals that we have. Just one moment here, everybody. I just want to pull up my... So sorry, Samara, I need you. Is it just, I just want to put up my little notes.
So
I totally made a mistake here. Pardon me, everybody.
I think it's presenters.
Thank you so much. Thank you. My apologies, everybody. So just want to go over a few goals for our event today, our gathering, and what we're hoping that you, in joining us, will take with you when you leave. We're just really hoping we can increase your knowledge about breast cancer, who is at risk, and really why early detection matters so much. We are really encouraging you to get regular screening get regular mammogram screening. If you meet that criteria for screening, and so that we hope even that at the end of today's session, and then when we part ways, that you leave considering scheduling an appointment for yourself, and that you feel more comfortable talking to your health provider about your thoughts, maybe around your risk, and just asking for some support accessing breast cancer screening. We definitely would love to break down stigmas, myths, and fears around cancer. It's not a bad word, but I think for a lot of us there is this discomfort, and there's fears, and with that can come misinformation. And so we're hoping that we can bring some new info to you, increase your comfort around discussing breast cancer and screening, and also just challenge any inaccurate and harmful information. And finally, we really hope that you take this information and that you share it with others, your friends, your family. And through this, when we speak with honesty and care, we really are impacting other people's lives. And maybe in that moment, we might not know it. But one conversation, one moment when we use our voices and we speak with that strength and that love, we are creating waves and ripples that will impact others within our community. Alrighty. Oh my goodness, I'm jumping ahead here too far. Just a really brief little bit of information. All the info that I have within these slides is from the Cancer Care Ontario site. And so this image is within their site too. Just to really quickly touch on what cancer is. And it's when some cells within our body, they become abnormal and they start to divide and grow uncontrollably. That's what forms those little lumps or those tumors that we talk about within the body. And as it relates to breast cancer, this really commonly starts within the milk ducts within the breasts, and it can, if left untreated or undetected, it can progress to other areas within the breast or within the body. At any time too, Chelsey, if you think of anything to add, please join in.
Yeah, I will.
And so just to really chat about risk factors that can increase our risk of developing cancer. This is for everybody, not just women can develop breast cancer, but men can as well. And so we're both exposed to both estrogen and progesterone hormones, and it's that estrogen hormone that's a really big player in the growth of breast cancer. And so for these risk factors, some may be familiar to you, but our age, the older we are, if we're past that menopause age over 55, that can be a higher risk for us. If you or family members have history of breast cancer or other cancers, that can also be a risk for you. For those, just to kind of sort of step back into that component about estrogen and our exposure to estrogen, for those of us that start our moon time early in our lives, or we get our periods earlier, we will have a longer time in our lives where we have higher levels of estrogen in our body. And so that can actually be a risk factor. If we consider pregnancies in our life, if we don't have any pregnancies, if we are using birth control pills that have a higher estrogen content, all of these things can just increase that our exposure to estrogen, which we very much need in our lives and in our bodies, but it also has that that other side to it where it can encourage the growth of some breast cancers. Okay, so when we talk about screening today, When I speak of screening, I'm only, just for the sake of this this event and this presentation, I'm really just talking about mammograms. But screening can mean other types of imaging as well. It can also be, so a mammogram is an X-ray image of your breast, but you may hear from somebody that you know that had an MRI or magnetic resonance imaging to detect or their breast cancer. And so for the sake of this presentation, MRI has, and I was talking to Chelsey about this earlier before we went live, but there's a specific criteria you would have to meet and a specific history. There's a very, what's the word?
It has to be within the high risk. You have to be in the high risk program in order to get the MRI of your breast.
Thank you. So you have to meet like a series of very specific criteria to even have that MRI. So I just wanted to mention that. The standard is a mammogram, which is an X-ray. Okay, and later on too, Chelsey is going to be talking about the mobile cancer screening bus, and she's also going to be talking about cervical cancer as well. Okay, I wanted to also just mention like why this is a really important time in our lives, and why that discussion and that conversation around breast cancer is so important. And that's because only very recently, just a year ago, the breast cancer screening guidelines, they expanded, and those recommendations changed to include people who are younger and as young as 40. So for those of us who are 40, I can't remember the top age right now.
74.
Thank you so much. So age 40 to 74, we are able to self-refer ourselves for screening mammograms. And that is why we can call the number for the Ontario Mobile Screening Bus and schedule ourselves in on our own. We do not need to speak to our health provider about that to get a referral. But if you feel more comfortable, that is also still a way that you can access mammograms within your community. This is really, really great and really wonderful that these guidelines have expanded and that they are screening younger people now for breast cancer. I certainly remember back in the day, and not too long ago, where for those of us who were at a younger age and weren't deemed as high risk, the recommendations were really about our own responsibility to view our breasts, look visually for changes, and also do self-exams with our hand, feeling for lumps, and to do that regularly so that we would know, so that you know what like a normal exam would be, and that you're able to spot anything that's different. And so why is screening important for us? We know that mammograms are able to detect lumps that are much, much smaller than what our hands can feel or our eyes can see. And so we also know at this time that our rates of cancer, diabetes, heart disease, they're rising among Indigenous people. And First Nations women are more likely to be diagnosed later on in the stage of their cancer compared to other women in Ontario. So that screening, that early screening, that frequent screening is really important to combat that. Okay. And this is also another way that we can challenge those health inequities that we face within the healthcare system by taking up that space, booking those appointments, and going to screening regularly. We are able to, as I said, take up that space in the healthcare system and make our requests for safe environments and for safe care. Now, screening is still evolving, just even outside of the changing guidelines. There are more healthcare agencies. Sorry, is that me? That's beeping part of me. Can you just... Thanks, Sam. So sorry. There are more health agencies across Ontario who are really striving to create more culturally safe spaces for Indigenous people. Here at ONWA, we have health system navigation support through our Mindemoyan Health Clinic. And if you feel like you would like to access a clinic that you feel would be more culturally safe, feel free to call us at our Mindemoyen Healthline number. It'll be posted in the chat right now, and our health system navigator can help you find a screening center in your area. And also another aspect, and I'm not actually sure how long the mobile services have been around. For me, it seems like it's been a really long time, but
it's a very long time. Yeah, we're currently on our third coach, so it's been since the 90s, I think, but don't quote me on that. I'm not quite sure the exact date.
But that's really great to hear. So a mobile services can help meet people where they are, and for those of us who have like transportation can be a barrier, maybe there's mobility issues, there's so many things that can keep us from getting out to those appointments and those centers for screening, and so that's really great that service is available.
Yeah, we bring the clinic to you.
And just finally, I just wanted to make a note and call out to everybody that caring for ourselves is a really powerful thing that we can do for ourselves. It's a part of maintaining our physical health. It's not an act of selfishness. It's not, caring for ourselves shouldn't be something that ends up being a low priority on our task list. And just you, by being here today and joining in our conversation, sending us those questions, just listening in to today's talk and becoming more informed, this is you giving yourself self-care, providing yourself with that self-care, and being proactive by joining us today. So thank you, everybody. And this is my very last slide. I wanted to just send out there to everybody just a moment where we can just reflect and what we think in this moment would self-care for ourselves look like. How do you see yourself bringing in some of the information that we share today into your lives? So this could be those old ideas too around maybe just becoming aware of your body and noticing if you think that something may look unusual. Doing that self-check in the mirror. Screening is still the recommended way to detect cancers and abnormal cells, but there still is that element of self-care where you're taking those moments in the day to focus on yourself. So self-care can also be calling and scheduling yourself that doctor's appointment to talk about your risks for cancer, to talk about mammogram screening and having those questions answered, or by calling and booking your own screening appointment. This could also be calling that health system navigator at ONWA at the Mindemoyen Clinic in Thunder Bay and asking for their assistance as well in accessing and scheduling a mammogram appointment or other cancer screening. And self-care can also be sharing this knowledge that you heard today with your family or friends. Because when we advocate and we support the health of those around us, those people in our community that we love, we are also providing that self-care for us. So thank you so much, everybody, for your attention. I'm just going to pass the microphone over to Chelsey. Welcome. Thank you so much. I'm just switching over here for the screen to pull up your presentation. Are you able? Oops, so sorry. My poor brain right now.
Just while the
slideshow.
Thank you so
just
much.
while it's opening up, did you make your earrings? I wanted to ask.
Yes, I did.
They're beautiful.
Thank you. Okay, so what to expect when going for a mammogram in Ontario. We're going to talk about the screening guidelines, the processes, and some frequently asked questions. So first I would like to offer a land acknowledgement. So I'd like to begin by acknowledging that we're on the traditional territory of the Fort William First Nation, signatory to the Robinson Superior Treaty of 1850. We honor their long-standing connection to this land, their culture, traditions, and stewardship. As we gathered here today, we also recognize the impacts of colonization and commit to working towards reconciliation and mutual respect. Good afternoon. So I'm Chelsey. I've been a medical radiation technologist for over 20 years, specializing in breast imaging, mammography for the past 13. During that time, I've acquired specialized certifications in both diagnostic and screening mammography. I'm passionate about women's health, ensuring high quality imaging, and supporting early detection to improve patient outcomes. So why mammograms matter? They matter because early detection equals better outcomes and less invasive treatments, detects changes too small to feel, and helps reduce the mortality from breast cancer. Who should get screened? These are the Ontario guidelines. So people of average risks between the ages of 40 and 74 with no symptoms, no prior breast cancers, and no mastectomies. Anyone over the age of 74 may continue to screen, and it's recommended that you do. It's something simple. It's a simple test for you to have done. You will need a doctor's referral every time you come, and you stay on your same rotation. If you come every 2 years, you will still come every 2 years after 74. There are high risk people that are high risk, so that's between the ages of 30 and 69. Those are with family history, genetic risk, and usually their mammograms are accompanied by an ultrasound and or mammogram, or MRI, sorry. At any time that if you feel you're asymptomatic, you find a lump, skin changes, or have unexplained pain or nipple discharge, you will need a referral from your practitioner to get your mammogram, no matter what age you are. So the frequency of screening, so for average risks, between the ages of 40 and 74, it's every 2 years normally. High risk, it's usually annual with combination of MRI and ultrasound. May need earlier screening, so the high risk people may need earlier screening and more follow-up if you have the high risk factors or you have dense breast. If symptoms are present, you'll need the diagnostic mammogram, meaning you need the referral. So how to prepare for your mammogram. It's best if you try to schedule 1 week after your period because usually your breasts are tender. Don't use deodorant, lotions, or powders because they can interfere with the imaging and cause callbacks. Bring your health card and tell the staff if you have implants, if you're pregnant or you're breastfeeding.
I have a question. I'm really curious. For things like the deodorants and lotions and powders, what does it do to the imaging?
So it can mimic microcalcifications. So, and then you'll have a callback because the doctor doesn't know if it's actually a microcalcification. So microcalcifications aren't a bad thing per se, but if you didn't have them on your last mammogram and you have them on then your next mammogram, they're going to bring you in for further imaging. If they're diffuse in the breast, then that's usually a normal thing, but if they're clustered up in a small area, that's another thing that they would bring you in for. So your deodorant can mimic those microcalcifications, so they will bring you in for follow-up, which causes stress and unnecessary tests. Yeah. So just no deodorant,
so
lotions,
it
or
shows
powders.
up as like an extra like white
little
area.
specks, little spots.
Okay.
Yeah. And the breast cancer you spoke of, the ductal carcinoma, that's the most common breast cancer, right? So it develops in the duct, and that starts with microcalcifications on the image. So that's why they would bring you back. So just no deodorant is best. Okay. And we do have wipes. If you forget and you come to your appointment, we do have wipes at the hospital and on the coach for you to clean the deodorant off.
Okay. Thank you.
So you don't have to cancel your appointment because you have deodorant on.
That's a good question.
Okay, so during the procedure, the technologist will explain the process. The breasts are positioned by the technologist onto the machine one at a time, and then the compression paddle is lowered. Images are taken from 2 different angles of each breast, and the compression only lasts seconds. Usually your appointment is 15 to 30 minutes total. So I have a little video here of my coworker just explaining how we position the breasts and showing how the machine moves.
Oh, sound.
Sound. Okay, so how do I?
I'm just gonna see here. It might be on my end.
Mm-hmm.
Oh. Is it with yours, CJ? It might be me that have to. Okay, just 1 moment. I might get Samara to jump in because she always. I feel like you're the.
Is this on Zoom?
We're in Zoom. So sorry, everybody. Okay, where was I?
It's on the computer right there with the X's.
No, it's here when we share.
Have to stop sharing.
Thank you.
go to settings. So like audio settings.
Mhm.
And then let's see. Oh, I haven't done this in so long. Go back to audio. Browser filter. Oh shoot.
Oh my goodness.
Go to video.
We can play the video and I can just explain what's going on in the video too.
We can, or CJ, with your, are you able to load up the?
So I'm seeing if we can share the video as a link so that people can go see it in the chat.
Okay, cool.
Just waiting to hear back from.
We're just seeing if we're going to be able to share the video with everybody, that you can click on it and. Okay, so I'm just going to do this one last quick check here. It's been a while, since we.
Yeah. I think it's changed a little bit too since I last looked at this. Because usually there's a video audio setting.
Sometimes when you click share, you have to share with audience.
Okay, let's just do that. All right, thank you for saying that one. Maybe that's it. Also share system audio. Okay, you're a wizard, a
there you go.
genius. Okay. Okay, entire screen.
Make sure your speakers are turned on too. Like that on your computer or it will come through.
So then will you? Okay. I'll turn that on. Do you have the microphone off then?
Mm-hmm.
Okay.
Place one breast at a time onto our x-ray machine. We will hold your breast in place while a firm plastic compression plate is lowered onto your breast to compress your breast. Once the plate has properly compressed your breast, we will take an x-ray of your breast. The compression plate automatically releases as soon as the x-ray is taken. Your breast is only compressed for a few seconds. We will repeat the process on each breast in 2 different angles. The whole appointment will be approximately 15 minutes.
Okay, so after the mammogram, you will get your results. So if you're going through the screening channel, the results get mailed to you and to your doctor. So your result letter can say normal results, we'll see you again in 1 or 2 years, or there'll be abnormal findings. If that happens, we have breast navigators that give you a call, your doctor follows up with you, and on that abnormal finding result letter, we'll have your next appointments booked already. So that would look like more mammography images combined with an ultrasound, perhaps a biopsy. Just to note, it's also good to note that most abnormalities are not cancer. So the discomfort and risks. Compression may be uncomfortable, but it's only for a few seconds, and it's very low dose radiation, so the benefits outweigh the risks. You want us to find that little speck of cancer before you can feel it.
In your experience, do you find that there is some people that find it totally comfortable or not painful at all?
Mm-hmm. Most people find it not painful. I love doing first-time mammogrammers because they leave and they're just like, that was it? Really? I was expecting it to be so much worse than it actually was. So with the compression, it's supposed to get tight and uncomfortable, but it should never be painful. And you can let your technologist know if something is uncomfortable or painful, and they will do the adjustments they need, but the compression is also very important. Okay, so recent changes in Ontario, they lowered the starting age from 50 to 40, average risk people. And patients with breast implants can now book their mammograms without a doctor's referral as well. So tips for a smoother experience: ask all the questions you want, schedule your mammogram after your period, try to relax your muscles during compression. I know I say the word relax to my patients all the time. Relax your shoulders, relax. It'll go a little bit smoother, and communicate with your technologist if the compression is too painful. The compression is to be tight and uncomfortable, but never painful. So always let us know if it's hurting, and we will adjust. We want you to come back. So in summary, the screening age starts at 40 now. Usually you come every 2 years for your mammogram. Patients with implants can now self-refer, and the procedure is quick, safe, and it lasts about 15 to 30 minutes. Okay, those are the resources. So now we're going to talk about what to expect when going for a cervical screen in Ontario. So why screening matters. Prevents cervical cancer. It detects HPV early. Saves lives. HPV causes most cervical cancers, and early detection makes treatment easier. So who should get screened? The Ontario Cervical Screening Program recommends that most eligible people get screened every 5 years now. If you're a woman, two-spirit, transmasculine person, or non-binary person with a cervix, ages 25 to 69. If you've ever had sexual contact with another person, screening for HPV with a cervical screening test every 5 years is as effective as getting screened with a pap every 3 years. And then you can stop your cervical screening at age 70 if results are normal. So why cervical testing, pap smears or HPV tests is generally not recommended before the age of 25. So HPV infections are extremely common and usually temporary in younger people. HPV is the main cause of cervical cancer. In teens and young adults under 25, HPV infections are very common, but the body almost always clears them naturally within 1 to 2 years. Testing too early often detects these harmless short-term infections, which don't require treatment. So abnormal results are usually not cancer, but can cause harm if acted on. Abnormal pap or HPV results in younger people are usually due to temporary changes and not pre-cancer. If these are followed up with unnecessary biopsies or treatment, they can cause physical side effects like scarring of the cervix, which may affect future pregnancies, and also emotional stress. Cervical cancer is very rare under the age of 25. Even though HPV is common in this age group, progression to cervical cancer is extremely uncommon before the age of 25. The balance of benefit versus harm shows that starting earlier doesn't improve health outcomes, but does increase unnecessary interventions. Evidence shows screening is most effective starting at age 25. Large studies worldwide found that starting cervical screening at 25 or sometimes 21 in the US guidelines prevents cancer effectively while minimizing unnecessary procedures. So why is HPV testing every 5 years now? So number one, it's stronger testing with HPV versus pap smears. Older programs used pap smears, cytology, which looked at cervical cells under a microscope. Pap smears aren't very sensitive, so they need to be repeated more often, every 2 to 3 years. Now, many programs use primary HPV testing, checking directly for the virus that causes a cervical cancer. HPV testing is much more sensitive at picking up people that are truly at risk, so it doesn't need to be repeated as often. Cervical cancers develop very slowly. Even when someone has a persistent HPV infection, it usually takes 10 to 15 years for it to progress to cancer. Because of this slow progression, checking every 5 years is still safe. It leaves plenty of time to detect and treat precancerous changes before they become dangerous. So it's also reducing unnecessary tests and procedures. More frequent screening increases the false positives and leads to more biopsies and treatments. These extra procedures can cause stress, cost, and in some cases medical risk, like cervical scarring, which can affect pregnancy. A 5-year interval gives excellent protection while reducing these harms. Evidence from large population studies. So countries like Australia and the UK studied outcomes when they switched over to the 5-year HPV testing. Results showed that cancer rates stayed the same or even dropped because HPV testing is better than the pap smears, providing that longer interval are safe and effective. So in summary, screening every 5 years now, we're screening every 5 years now because the HPV testing is more accurate, cervical cancer develops very slowly, and less frequent screening avoids unnecessary harm. So what is the HPV test? It's a cervical swab, and it checks for high-risk HPV. As how to prepare for your cervical screen, you have to book with your provider and bring your health card. So during the tests, a speculum is gently inserted, sample is collected, and only takes a few minutes. So results and follow-up. So if your HPV test is normal, you come back in 5 years. HPV positive, you have some follow-up, but most infections clear. So the negative HPV test, you're considered low risk, return to routine screening, usually in 5 years. Positive HPV test needs follow-up, but not always immediate with a biopsy. So discomfort and risks, there could be some mild cramping and spotting, and there's rare false results. So Ontario program updates for the cervical screen. There's self-sampling projects in pilot projects right now. HPV tests replaces pap tests in Ontario, so they're more accurate and less frequent. So the self-sampling info. So what is self-sampling? Instead of a clinician collecting a sample from your cervix with a speculum and a brush, like a pap smear, you collect the sample yourself using a swab or a small brush. The samples are usually taken from the vagina, not directly from the cervix. But research shows it is still highly accurate for detecting high-risk HPV. Ontario has rolled out self-sampling pilot projects in certain sites, but has not officially launched the program across the province yet. So in summary, HPV screening starts at 25, and HPV is tested every 5 years, and it prevents cervical cancer. What's your question?
Is there like an upper age limit for screening?
For cervical screen?
Yes.
So right now the guidelines are if you have 3 normal pap smears in your 60s, then you're done. Okay. So 70 is usually the last, the upper limit of having a HPV screen. Okay. So after 70, you don't need to do it. So with this slide here, there's just some phone numbers on how to book your screening, whether you're going for breast screening or cervical screening. So we have the Linda Buchan Center at the hospital, Thunder Bay Diagnostics, Riverside Healthcare Facilities in Fort Francis, Lake of the Woods District Hospital in Kenora, Sioux Lookout, Minoyawan Health Center, and then you can always call the Screen for Life coach and see where we're parked during the year. For your cervical screening, to book an appointment with your healthcare provider to complete the cervical screening tests. If you don't have a healthcare provider, you can contact these following locations and to get your cervical screening done.
Okay.
That's my last slide.
And I just would like to add too, again, just to chat about our Health Systems Navigator at the Des Moines Health Clinic here in Thunder Bay. If you are joining in or viewing virtually from Southern Ontario and you're curious about what might be in your area, feel free to call us here, and I believe you're connected right away to our Health System Navigator, and they can go over, they can have a look, and they can help you find a location that's near you. I have a question about, I'm still really thinking about the mammogram appointment and like what to expect. Mm-hmm. And I think you had said earlier that you've been doing this a really long time, and I was wondering, what are some common questions you get from people in that appointment that you hear during their appointment?
They ask me if the compression causes the cancer. That is a complete myth. The compression will not squeeze the cancer, pop the cancer, set the cancer free in your body. The compression is just very important to keep the breast still and to minimize the radiation dose because we make it nice and thin. So there's that one. There's also that the radiation caused the cancer. That is also not true, because people come in feeling fine and great, and then they have follow-up, and it was, ends up being cancer after all their tests. And that is not true. It's just because we found it so small before you were able to feel it. Those are probably the most common ones, that the radiation causes the cancer and the compression causes the cancer, which is not true. Another thing is people always just leave so surprised that it wasn't as bad as they thought it was going to be. You know what I mean? It was, people think that the compression is going to be so painful, and they're just always surprised and relieved on how comfortable it was, because we're not here to hurt you. We're here to do the test and do it properly. And if someone needs a little bit more encouragement with the compression, we just come down nice and slow. It's not we work with the patient to make sure they get their screening done and that they come back for years to come.
That's great to hear.
I had a question.
Mm-hmm.
Can someone bring a support person into the appointment if they feel they need
Oh
that
yes,
support?
yes. We'll never deny someone with that needs a support person. We are working with radiation though, so if during the exposures, if the person's able to step out, that's fine. But if someone needs to be in there, by all means, I'll just put them behind that shield that I stand behind, and we'll just do it that way. Whatever makes the person comfortable. Mm-hmm.
Thank you.
Mm-hmm.
Nice.
I think we have other questions here. I know that the criteria to do the self-referral is that you have no symptoms.
Mm-hmm.
Have you ever had anybody who made an appointment and came to the appointment and had identified that they were having symptoms?
Oh yeah, for sure. Especially out in the region, when I work on the bus, they'll book their screening appointment, and they'll be like, "Oh, I found this lump here, but I was coming for my mammogram anyways." We're never gonna turn anybody away just because it wasn't booked in the right guidelines. In the end, it's still the same for 4 pictures, right? So I'll just put extra notes and let them know that there was a lump that was found. Then we just ask the questions: how long has the lump been there for? Did it get bigger, smaller? Is it painful? Anything else changes in your breast? So we'll never turn someone away if they came to their screening appointment with a symptom.
And with new information.
Mm-hmm.
That's really good to know.
Mm-hmm.
Yeah.
That said, though, if you do have a lump, usually it's booked. You have a mammogram with an ultrasound, so that person would have to come back for an ultrasound at a separate appointment, because we can't do that on the spot. But the mammogram would get done that day.
Okay then.
Mm-hmm.
Okay.
Sorry, I have one more question. And you might have already mentioned it, but could you let us know how long it usually takes for the turnaround for the mammogram to be read?
Breast imaging is super quick, and that also scares people because they're not used to having the results so quick. Breast imaging is always very quick. I would say within 2 weeks you would have your results. And if there is something to follow up on, the radiologists read them really quick. And then our breast navigators are on top of it, calling you and letting you know, this is the next thing. Do you have any questions? We're booking you for an ultrasound. We're booking you for these type of mammogram pictures, because it's more mammogram pictures, but just different depending on what they see. We have different ways we can do it. So yeah, it's
pretty quick.
It's pretty quick, yeah.
That's good.
Yeah, it's I would say about 2 weeks. I usually tell them a week or so you'll have the results.
That's awesome.
So we got one more question here.
Mm-hmm.
The bus.
Mm-hmm.
Can we hear a little bit more about that? What is it like? What's the overall vibe to it, if you will?
I'm curious about that myself, because Samara and I, we've hosted some of the bus screening, and we're always outside in the parking lot. We see people when they go in, but we ourselves haven't been on the bus either. So I'm curious to hear too, what's it like when you first stepped into the bus?
So when you first step into the bus, you'll come up a set of stairs, and then there's the driver's seat there, but then you'll turn, and then we have a waiting area on our Instagram page. Maybe we can link that in after. The Screen for Life coach has an Instagram page that has a whole bunch of videos and reels of showing what the bus looks like on the inside. So you come in, there's a little waiting area, and that's when you'll meet the staff, and we'll do our intake there, take your health card. Then you walk a little bit further down the bus, and then there's the nurse's room where they do the colorectal screen and the cervical screens. And then a little bit further down, there's a change room, and then the back of the bus is where the mammogram unit is, and then that's where you get your mammogram done. The bus is wheelchair accessible as well, so we do have a wheelchair lift that would help people in the bus if need. But yeah, it's pretty much like a retrofitted tour bus.
And how many staff are usually working in the bus each time?
2. There's a nurse and there's an X-ray tech that's working on the bus.
Okay.
So the nurse takes care of the cervical screen and the colon cancer checks, and the X-ray takes care of the mammograms.
And I'm assuming you've family, if there is support people. I feel like there was one time too, there was even maybe a family member, like a child that came in too.
Mhm.
And I was wondering where they would be. It sounds like they're probably like in the waiting area.
Yeah, yeah. If usually if there's someone has to bring their child with them, they would just stay in the front, and the nurse would probably just kind of stay out there. But sometimes the nurse can be busy, so it's really recommended not to bring your kids. But stuff happens, and you have to sometimes, and we understand that, and usually they just stay at the front. We don't let the children inside the exam rooms.
Yes, yes, for sure.
That makes sense. Alrighty.
Thank you so much.
One more question.
Okay, great.
It's also about the bus. So we're going to be sharing out the Instagram profile there for it, but from the photos of it, it's a regular bus with windows and stuff.
Yeah.
So I'm guessing people are having questions here about privacy of the screening areas themselves.
Yes. So in the mammography room, the windows are tinted so you can see in, but you can see out, but they cannot see in. But we have drapes too, and I close the drapes. If someone asks about it, I'll just close the drapes and just it's a super simple fix. But the privacy is there; you can't see in.
Perfect. So that's the last question we had for you.
I just had like a random question. Is there a bathroom on the coach?
There is no bathroom on the coach. That's a
Okay.
really good question because a lot of people think there is a bathroom on the bus. We don't have any running water or our bathroom facilities on the bus, so
Okay.
just to take note on that.
Okay.
It's good to know.
We just, Samara and I would probably like to just remind everybody that on November the 10th here in Thunder Bay, that the cancer screening bus will be at the complex, and the hours I believe are from
They're
8.
8 to 8. So the
Come on in, Samara.
the appointments times do vary. So if you were hoping to book an appointment, which we hope that quite a few of you do book your appointment on this November 10th date, that you call the screening coach. It's 807-684-7777. And like Carly said, we'll be there. And also, if you come for your screening, there will be some draw prizes, some swag. We usually have some more snacks.
Yeah.
Just like come and say hi. So we'd love to see you all come out. Hopefully it's a nice day. If not, that's okay too.
Yeah.
And so so it's just the appointment times do vary. So get those appointments in. I do believe there's a cutoff date of October 31st to get in for that date. And if you do have trouble or if you require assistance booking that appointment, please reach out to our Mindamoy Health Clinic and talk to our health systems navigator, who would be happy to help with that. I do believe that number is 807-697-1753. If you didn't catch that, you can just call us here at ONWA. So And so was that?
We also are probably posting the survey link again, and I just want to thank everybody for joining us. I want to thank everybody who submits a survey, shares any questions or any feedback that they would like to let us be aware of. We really do appreciate all those surveys that we receive from everybody. And as I said before, this is how we create our programming. And bring this information to you. So hopefully, I do hope that we see some of you on November 10th at the complex with us, and come say hi to us. And
So just wanted to say a big thank you to Chelsey, our
welcome.
guest speaker today. I'm so glad that you were able to come and join us today. And I've known you for a couple of years, so I'm like, you'd be so perfect to help us out with this. So Chimi Gwich for joining us today, and just like sharing your knowledge. You have so much of it. So we really appreciated you sharing that, and we hope that that all of you out there listening were able to take some points home today and add that to your knowledge bundle, and you're encouraged to share that with your family and friends. And encourage your family and friends to get screened as well. And Carly, thank you so much for your wonderful presentation as well, and just sharing, what the inner workings of everything, and sharing your knowledge as well. I think that's
Okay.
everyone. So hopefully everyone has a really great rest of your
Yeah.
day and enjoy this fall weather. And I hope you're all healthy and well.
Thank you so much, everybody. Feel
Thank
free
you.
to put questions in the chat still. The survey will be up until Friday evening. And so if you're watching this at a later date and time, please still submit some questions and we'll do our best to get back to you and bring you those answers. And up until Friday evening for that survey. Thank you so much, everybody. Take care.